What I want to do today is share with you some of the data that we've collected in this space. Our firm works with a lot of the companies in ophthalmology and in the self-pay elective space with the goal of expanding demand for those technologies. Two papers just being issued this week. One, a survey of 205 laser cataract surgeons. The other, a survey of 101 ORA surgeons using the intraoperative aberrometer during surgery. And the question of how quickly or what percentage of patients is the laser used on, you can see in this chart now that it moves very quickly in the dashed line from the first month of use up into the 25 to 35% band and stays there. And the trend line that we've developed, Mike Lockman and I have put together, shows that we think, based on the data that now goes back over 2 years since the earliest users, that 30% or just north of that is a very reasonable assumption in terms of what percentage of overall cataract surgery in a practice will be done when it adopts the laser. When we ask the question which IOLs is the laser being used in conjunction with, it's 66% of those premium IOLs, the toric and the presbyopic lenses. It's 20% of the conventional IOLs, but given that the conventional market is so much bigger, it's 78% of the sample here in this survey, it's a 30% blended average of all intraocular lens implants being used with a laser. Next question is, how much are surgeons able to charge for the laser in addition to other fees they may be collecting? Most of that would be the reimbursement provided by third party. And when you look at this stratified by the type of lens implant, and most surgeons use some type of tiering of refractive packages that mirrors the implant that's being implanted, you see that a weighted average across all IOLs is $859. The weighted average calculation is especially important because some surgeons did not raise their fees for the premium segment of their practice once they got the laser, but most did in the conventional sense, and that most weren't doing something for the monofocal IOL in a refractive sense prior to getting the laser. Now they are, and the average fee increase was just over $1,000. We see that the importance of the conventional IOL not only being about half the procedures that are being done, but actually contributing the majority of incremental fees. So in the units dollars analysis, the monofocal IOL actually has more significance to the laser cataract category. And when we do an analysis to see whether or not surgeons can afford this technology, this is all data that came right out of the survey from surgeons telling us how much they're charging. We've already talked about that, $859. We know the average cost of the per-use fee, which includes the disposable. We can calculate per-case margin. We also need to know the fixed cost to acquire the equipment, both the laser and service out over 5 years. And with those together, we can do a calculation that says over 5 years, they need to do a little over 1,100 procedures, and it's 19 a month is they need to be doing with the laser. Now, if we reverse engineer and take that 30% penetration rate within the practice, we can say that a surgical practice that's doing 757 cases will likely break even. The issue is how many are breaking even, and as it turns out, many are. The vast majority, 75%, are above that break even, what the baseball analysts call the Mendoza line of 19 cases per month. And in fact, the average laser is doing 3 times that amount at 57 cases per month. And we have several on the far end that are doing well over 100 a month laser cataract procedures. These are very, very large practices. This kind of study and research would not be possible without the support of a lot of people. First, the 4 manufacturers that have commercial devices here in the U.S. I want to acknowledge Alcon, Bausch & Lomb, Lenzar, and Optimedica for their financial support. And secondly, the doctors and administrators, over 200 of them, provided data on nearly 300,000 cases over the last several years. And we've been able to estimate that we now think that laser cataract has penetrated between 2 and 3% of the U.S. market here and is on the rise. Let's turn to ORA and the WaveTech aberrometer for a second. Surgeons are getting this device for 2 very simple reasons. It is giving them more confidence to speak to their patients about the benefits of refractive surgery, hence the conversion rate is going up, and they're doing fewer enhancements. That's a very powerful combination for a refractive cataract surgeon. Patients are also seeing the benefit of this technology and are willing to pay several $100s per eye to have their cataract surgery done with the ORA to give them the best vision possible following cataract surgery. And when I look at the 3-year trend of placements going back to this is the year end 2011, 2012, 2013, we predict that Aura will have 337 units in the country, and there will be 278 femtosecond lasers. These are actually growing at a very similar rate. And in fact, Aura is going to grow a little faster for one reason. It's a lot less expensive in terms of a capital investment to get involved with the surgery and with the technology. And, you know, we look at cataract surgery in the U.S. and worldwide over the next few years. It is going to continue to grow a few percentage points a year. The population's getting older, so demand for advanced technologies in an aging population with a baby boomer mindset is a very, very good perfect storm combination. And I think the leading surgeons, you know, if you think about the Aura surgeons and the laser cataract surgeons, they're the bellwether of what's going to happen. And if you look back historically, look back to the era 2003 to about 2009, before any of these two technologies that I've discussed were available, the average in this country was 14 to 15% conversion to either a toric or presbyopic IOL, and those are roughly evenly divided. We now see in this data set with the 100 Aura surgeons, they're now converting 38% to some type of refractive package, and 2/3 of them actually offer just Aura by itself. So now in these practices, the majority of their patients are having some type of refractive surgery on top of the reimbursed cataract surgery. So I think this is a very good indicator for the future. Thank you very much.